Welcome to our sixth video. Today we're going to talk about insulin insensitivity. PracticeBump.com has this this whole entire course in a manual, and we decided to put up some free marketing materials as well, including the question-by-question nutritional history guide. So feel free to go there, download whatever's free. If you want all of this material in print, you can get yourself a copy of the manual. The manual, if you use the coupon code nutrition, it'll knock 60% off of the price. I'm Dr. Paul Varnes. My company's Whole Health America. There's my phone number. If you want to email me, use my personal email at onearborvitae@comcast.net. And feel free to contact me with any questions. Chiropractors are always scrounging around for musculoskeletal patients, and yet there's so many Americans that don't feel good and have problems because they're insulin insensitive. I mean, we're getting into metabolic syndrome, high cholesterol, high blood pressure, type 2 diabetes, and just simply being overweight. Okay, between 1976 and 2002, there's been a 38% increase in the number of American adults who are overweight. And the number of obese Americans has doubled in that time period. It's an epidemic, and we should be addressing it. And even if the patients aren't compliant, you should be mentioning this to every single patient because your office is about health. It's not about backs. About half of all Americans are overweight, and 25% of Americans under the age of 40 are obese. And you have tools to address this much better than anything that the medical profession has. And if people are overweight, they are insulin insensitive. They're heading into insulin insensitivity. And according to a Yale University study done in 2002, more than 13 years ago, 20% of American children were overweight then. That number has increased by 2012 to 33% that are either overweight or obese. And more than 25% of children between the ages of 4 and 10 and 21% between the ages of 11 and 18 have early signs of type 2 diabetes. And this was back in 2002. These numbers have probably gone up by now. Insulin is involved in fuel storage. It's an anabolic hormone. Glucose transports sugar into cells. 80% of the body's cells become permeable to glucose when insulin binds receptors to cell membranes. Sugar is then phosphorylated and used as a fuel. And then it's stored as glycogen for short term for later use as energy. Now, if you're eating too much sugar, it's converted to triglycerides and then the fat. And in the presence of large amounts of insulin, which people eating a lot of sugar get, we don't burn fat, we deposit fat. And since you're a chiropractor and you're dealing with inflammation and pain a lot of the time, fat cells produce inflammation. So this has to be dealt with. Symptoms of insulin insensitivity include fatigue, weight gain, brain fog, craving of carbohydrates. You start a cycle. You produce too much insulin, you start wanting more carbohydrates to calm it down. Sugar and refined carbohydrates are addictive. You have periods of hypoglycemia after a high carbohydrate meal. And a lot of times a person who's insulin insensitive, a little overweight, they need a nap right after they eat. That's a sign of insulin insensitivity. It's also a sign of hydrochloric acid need, but anyway. And they'll be prone to mood swings. So a lot of people, Dr. Vreeland did a great CD on inflammation and being overweight and how it ties into depression. And there's a lot of people on antidepressants. If you get their insulin under control, you might actually be addressing problems like that. Okay, and the average American consumes nearly 200 pounds of refined sugar each year. We get half our calories from refined carbohydrates. You need to be addressing this in every single patient, whether or not they listen to you or not. Okay, like I said, your practice is about health, and you should be able to address it using the language patterns we talked about. When you decide to give up refined food, I'm sure you'll begin to feel better, don't you think? Or some such. And we're not telling you to nag people or to become a food Nazi or anything like that. But you do want to be addressing this. They need to know that you support them, but you are all about health. And gently remind them that their symptoms are tied to their diet. So eating too much sugar will cause the body to produce too much insulin. Creates vitamin deficiencies. People eat a lot of junk food. I mean, if you give them B vitamins, you're doing them a great service. Over time, the body becomes insensitive to insulin, and that can lead to metabolic syndrome that can lead to type 2 diabetes. So over time, insulin insensitivity can lead to type 2 diabetes, Okay, type 2 diabetes is due to insulin insensitivity. Type 1 diabetes is what they call the juvenile diabetes. There's a difference. Type 1 diabetics tend to be thin. They need their insulin. You're not going to wean them from insulin. Type 2 diabetes, they're making plenty of insulin. Their body just stopped listening to it. It's sort of like every time they eat sugar, it's like the body's crying wolf, and the body stops responding to insulin. You can do a lot for those people. Okay, the CDC estimates that 80 million Americans are pre-diabetic or insulin insensitive, and 28 million Americans are diabetic. So this is a huge market for you, and a market that you can really serve and do some good for. And this slide will just show you that diabetes is expensive. The estimated cost is $245 billion a year in this country, out of which $176 billion is direct medical costs. Okay, people with diabetes have medical expenditures of about $13,700 per year, of which $7,900 is attributed to the diabetes. And they're spending more than 2 times as much as someone without diabetes on medical care. If the patient's taking metformin or glucophage, they have a lot of side effects from that. A lot of digestive, nausea, vomiting, diarrhea. Okay, in one out of 10, so it's just pretty high incidence. So people would like to get off of this stuff. I will tell you this: the program that you offer them will help. They need to be monitoring their blood sugar while they're and weaning from a drug. You don't throw away the bad drug and then just make changes. And you don't make changes and keep the same dosage, because you're going to force them into hypoglycemia, because the nutrition does work. One thing I would call your attention to is there's a decreased absorption of B12 during long-term use in a certain amount of people. And in general, you know, if you're using the kinds of diagnosis we do, and you're looking at MCV and stuff, you'll find they tend to be a little low in B12. I would give them the B12 2000 lozenges a couple of days. There's 2 milligrams of B12 and some folic acid in those. So if you know someone on metformin, that's a nice little stopgap, keep you from having trouble. The B12 can't hurt them even if they have too much of it. And a lot of people who are insulin insensitive develop what's known as metabolic syndrome. It used to be called Syndrome X. They have high cholesterol, low HDL, or quote-unquote good cholesterol, high LDL, high triglycerides, and about half the people with high blood pressure actually have metabolic syndrome. So this is huge. So if you got somebody, you know, with a pot belly and they're taking Lipitor, chances are, you know, and you look at their actual numbers, chances are they have metabolic syndrome. Metabolic syndrome is defined by having a waist greater than 40 inches in men or 35 in women, triglycerides more than 150, HDL lower than 40, blood pressure above 135/85, and a fasting glucose of 110. If they have any 3 of those symptoms, you can safely say that they've got metabolic syndrome. And if they do have metabolic syndrome and they are on cholesterol medication, make sure you give them some coenzyme Q10. The Lipitor and drugs like that deplete CoQ10, and you're preventing them from having a lot of problems. A lot of patients have cholesterol medication leads to something called rhabdomyolysis. If severe, that's the body aches that they get when they're on the cholesterol medication. I could tell you this: a lot of my back pain patients, a lot of people that hurt in general, are taking Lipitor or a drug similar to it. Giving them CoQ10 will make them do much, much, much better. So if you've got somebody that, you know, can't hold an adjustment, they're hurting their back a lot, and they're on Lipitor, give them some CoQ10. And every patient that falls into this category, and you're talking half of your patients, probably more than half of your patients, because you know, these are people that don't feel good and are seeking out health care. You have to, whether they listen to you or not, you have to be talking diet. Like I say, not in a judgmental way, but you have to be all about health. The anti-inflammation diet is good. You might even lower carbohydrates from there. I like the paleo diet, Lauren Cordain's paleo diet, which takes them off of all complex carbs, and interestingly enough is kind of a hypoallergenic diet, and that's a good one. If they have a lot of weight to lose, then you might even lower carbohydrate consumption from there. And sugar and refined carbohydrates are addictive. So Supplementation can help you, use the language patterns. A lot of times, this is a process that will take long period of time to get someone on track with something like this. One thing that will help them control their craving is have them eat slowly and eat until they're full, and only have 3 meals per day. You want to try to get them away from snacking. And breakfast should contain protein and should be the largest meal of the day. And like I said, sugar's addictive. They'll crave it. You can give them some NutriClear, which is a pea protein that contains nutrients, and not as a meal replacement so much, but if they feel like they have to snack, or if they're flagging between meals, especially between lunch and dinner. Just take a tablespoon of that, mix it in some water, and drink that. That'll shut off cravings pretty well. The other thing is get them off of diet soda. A lot of people trying to lose weight drink diet soda, and it messes with their capacity to be satisfied with food. NutraSweet especially is a serotonin inhibitor. A lot of times, let's say I'm addicted to the diet soda, I can't get off of it. Usually it's Diet Coke or Mountain Dew or something like that. It's got a lot of caffeine. They're addicted to the caffeine. I've had good success with switching them over to coffee and then weaning them off the coffee. Other supplementation that can help with cravings is a product called Amino Acid Quicksorb. It's a combination of amino acids in liquid form. They can take 20 drops on the tongue, and it'll help with carbohydrate cravings. Works better for some than others. And a novel approach from Dr. Harry Eidner, is to have them take Gaminol Forte from Biotics Research and Bioglycozyme Forte 3 times a day. 5 tablets of the Gaminol, which is sort of a pituitary supplement. I don't want to get too much into what's in Gaminol. And a couple of Bioglycozyme, which is their traditional hypoglycemic mix. And it helps with growth hormone production. And maybe you've heard of the growth hormone diets where they put people on 500 calories and they give them homeopathic growth hormone and stuff like that. This is a way to accomplish something similar. I like a more reasonable diet. I find that a lot of people that do that 500-calorie diet have a rebound. One thing about extremely dieting people is that fat produces leptins, and leptin is a hormone that basically tells your brain that whether you've had enough food. So when your leptin levels drop, it's interpreted by the brain as starvation, and this is why people rebound off of diets. They can lose a bunch. I lost 50 pounds or whatever, and then all of a sudden they can't even do moderate control, and it's because of the leptin issue. And I've seen people on the HCG diets. I'm not crazy about it because I've seen them rebound. But if you do something reasonable, use the Gaminol and the Bioglycozyme, get their carbs down. Let them eat, but control carbs, especially refined, no refined carbohydrates. Spend a lot of time controlling how they eat and what they eat, and then worry about amounts later. And this protocol works really well with insulin insensitivity. I had a fellow who had triglycerides over 900 and wouldn't listen to me, would not. He liked sugar and he liked his drink. And he said, but I can take pills. And I gave him 2 capsules of glucobalance, which is a multiple vitamin that's designed for insulin sensitivity. Beta TCP kind of helps the liver eliminate fat. Bio-omega-3, a lot of research showing fish oil helping control with appetite. And lipoic acid, 600 milligrams of lipoic acid a day. There's research that shows that it can bring triglycerides down. I gave him those products, and we cut his triglycerides in half in a couple of months. And this is without a lot of discipline on the guy's part. Now they're pretty normal, and he actually started following the dietary advice. Like I said, I didn't nag him or anything like that. used the language patterns. Eventually, I started thinking. The line he used was he worked with a lot of political people, and he's he was in a state capital and he's the land of doughy white men, and he would say, I look at these guys and they're done. They're taking beta blockers. They're taking metformin, they're taking Lipitor, and they're just kind of gray and they look like hell. And he says, I don't want to go out that way. And then they started listening to his diet. So non-compliance is relative, I guess. If you don't get the kind of result that you want with your program, there's other considerations. A big one is food sensitivity. I once had a patient who had blood sugar was running 400, and the drugs weren't helping him or anything. We took him off of wheat, gluten, and his blood sugar normalized. And that's a fairly common thing. So when you're doing things that should work but they don't, food sensitivity is a good place to look. One of the reasons I like Lauren Cordain's paleo diet. Paleo diet is a pretty hypoallergenic diet. And we're going to go into food sensitivity in greater detail in one of the other. In the manual, it's written about. Okay, high triglycerides, 600 milligrams of lipoic acid we mentioned. Adrenal support. Stress makes you eat bad. And we're going to go into this in greater detail. There will be an adrenal video. Superphosphozyme from Biotics is also great. Insulin sensitivity is an acidic condition, and phosphates help to buffer. Phosphorus also helps with bone loss. A lot of osteoporotic women love their carbs. And sugar upsets the balance between calcium and phosphorus. So that's a good one. And, the one way to know that someone needs phosphorus is they have trouble getting out of chair. They get all stiff, moving, or get out of bed. I'm stiff. It takes me a while to get moving after a while. That's usually a sign of a need for phosphorus. You give them a couple of superphosphozyme twice a day, and they'll do much better. And I'd like to take a minute to mention L-carnitine. If you get someone exercising and they want to lose weight, and you have them take some L-carnitine, 500,000 milligrams of L-carnitine before exercising, it will speed up fat breakdown. Okay, we're going a couple minutes over. The nutritional history is in the manual. We can download it now. And this question-by-question guide for the nutritional history is free until February. PracticeBump.com, lots of free marketing materials. Also, you can download and buy the manual. I'm Dr. Paul Varnas. My company's Whole Health America. There's my phone number. If you have any questions, please, marketing anything. juanarborvitae@comcast.net is my personal email. Thank you. Sorry I went over.